Hey, we are live once again. You know what day it is. It's Monday, my favorite day of the week. I like to call this programming here How to Pass NCLEX. Also, we have some amazing news for you guys. ReMar nurses, yes, ReMar nurses, constantly representing success. I am so happy to see everybody live. You made it to the live class. It's one of the most challenging things to do, to actually make it here live. And then when you're here, you have a fantastic study session, which we'll be doing something different this week. So I'm glad you guys are here. Hey, actually, what we're going to be doing, before I tell you what we're going to be doing, let me just thank you once again for ReMar Nurse University. We did pharmacology for a whole month. And it was just a great experience. We got to talk about some in-depth medications, how to look at it. RN, PN, nursing student, everybody was welcome. Everybody was here. Shout out to all of my international nurses. Stand up early to make it to the class. We had over 1,000 nurses sign up for the virtual trainer. It was amazing. We have over 8,000 nurses in our VT community. And you guys know my goal is to have a 10,000 strong community. So we are getting there at over 8,000. Oh man, it's a tremendous opportunity to just to get your license. And I also want to say that, we have nurses coming in the virtual trainer, but we also have nurses leaving the virtual trainer, which is also great because that means that they're testing, they're canceling their VT subscription. They got their test date. They're like, I'm out of here. I got the information. I'm gone. And that's what I want for you guys as well. So to keep that going, so I said, thanks for RNU. I've learned a lot. Got 7 out of 10. Okay, awesome. So just to keep that energy going, we are doing something special today. We are going to do this. Okay, we're doing a Black Friday quick fact sale. Now this is just as a Black Friday review. We're gonna do the review today of the quick facts book. I have the book here, and I was like, I love this book. We were going to do a sale on it, but I'm like, instead of us doing our regular questions, let's just do questions from the back of quick facts, which people say is the most challenging. So we will attempt to do questions from the back of this book today. And I don't care if you guys write the answers on the screen. We're just getting into it. It's also on sale, 50% off for this week. So if you don't have the quick facts, or if you want to gift it to somebody, this is the time to do it. So we're going to begin. Check this out. We're going to begin our quick facts quiz. Now, listen, these are going to be quiz questions coming from the quick facts. Shout out to Rona. It's Monday Motivation again. Rona says, I passed my NCLEX RN for the 3rd time. Thank you. Awesome. Yes. So, Shanta says, love that book. So we're going to be studying this book again today. So I'm just going to put questions up on the screen. You can put the answers if you want to. If you don't, you can write them down. And at the end, we'll go over all the answers together. But this is just to make sure that you know this book, or if you don't have this book, you'll see how useful it is if you get it, studying it. So let's go. Question number 1. These questions come from pages 60 to 80. It's like 61 to 80. So the back of the book. Okay. All right. So question number 1 is this. It is this. Shingles or herpes zoster is caused by what virus? Here we go. This is how to pass NCLEX simply by using the quick facts for NCLEX book that's on sale. Not simply by using it, but by studying the information and knowing the content inside of the book. So this is my first question. I'm not going to stay here long because this is a self-assessment. Either you know the answers or you don't know the answers. Okay. So here we go. Shingles or herpes zoster is caused by what virus? What virus? All right. I am moving on. I got more questions. I actually got 20 questions today, so we got to get going. Question number 62, okay, is this. Tardive dyskinesia is a side effect of what medication? Come on in. We are quizzing ourselves on the Quick Facts book. Quick Facts is in the house today, along with everybody else. Whether you're a nursing student, your test is tomorrow, your test is next month. This is it right here. Tardive dyskinesia is a side effect of which medication? And remember, these answers are going to come from the back of your quick facts book. So this is just to, see if you know it. All right. It's just to see if you know this book. You've been studying it. Do you know it? All right. Tardive dyskinesia is a side effect of which medication? People are saying MAOIs. We'll see if that's right. All right. Here we go. I'm moving on. Next question, question number 63. What organism is the cause of tuberculosis? What organism is the cause of tuberculosis? This is our quick facts Black Friday sale. The price is 50% off. We only do that for Black Friday. So that's why we're like doing it early for you guys who are getting ready to take your exam. All right. Or if you're just getting into nursing school, perfect gift. All right. And try your best with the spelling. We're talking about here, what organism is the cause of tuberculosis? All right. I'm moving on. The answers are rolling in. Next question here is, hey, how often do you change the Total Parenteral Nutrition bag? You got to know this. You absolutely must know this. We talked about it during ReMar Nurse University this year. We talked about TPN. Okay. How often, first of all, do you know what TPN is? You got to know what it is. And then you got to know the nursing responsibilities. Okay. Cynthia, thank you. ReMar passed NCLEX on 7/17 after being out of school. 18 years. I took the test. I used the DVD package. Thank you, nurse, for coming back and reporting that amazing testimonial to us. 18 years. That's what I'm talking about. Everybody can pass this test, but you got to know stuff like this. How often do you change the Total Parenteral Nutrition bag? All right. You guys are doing good. It's looking really good right now. Here we go. Ooh. Iron supplements should be taken with what vitamin to promote absorption? Iron supplements should be taken with what vitamin to promote absorption? This is the fundamentals, the integrated concepts that you can just see on your exam that can catch you by surprise if you haven't studied them, if you haven't reviewed them. And that's what the Quick Facts book is for. Send it on in, send on your answers, smash that share button if you love pop-up quizzes. This is what this is. It's Black Friday on Monday here at remarreview. You got to keep up with us. We move so fast. All right, I'm moving on. Question number 66. This is from the back of the Quick Facts book. What is the cause of ulcerative colitis? I bet you guys don't know that. I'm challenging the first person to put the correct answer. What is the cause of ulcerative colitis? Quick Facts told you the answer. If you got your book, you got to get to the page fast enough. Like, you can't be doing this. Like, this is not how you do pop-up quizzes where you're like trying to get the answer. Just see if you know it. See if you know it. What is the cause of ulcerative colitis? Thank you so much for supporting this programming. It's totally free here at ReMar. All right. We do this for free because we love you guys so much. We want you to get your license. 2020 is a crazy year, but people are passing because they know this. What two organs are affected the most with Wilson's disease? Imagine you getting a question on Wilson's disease and knowing it because you purchased the Quick Facts for NCLEX book. That's a good feeling. That's a great feeling. All right. We're studying here. I see a lot of you guys have Quick Facts because these answers are just coming up too quickly. They're coming up so quickly. All right. I feel like I can move on because you guys are putting the answers up and you are self-reflecting, self-assessing. And that's what we do here every Monday. This is your motivation right here. This is it right here. The next question, we got question number 68 from pages 60 to 80. Coming up is, I like this one. What age group normally gets von Gierke's disease? Which age group normally gets von Gierke's disease? Put the answer down, and then let's just all say a quick prayer for Rose, who will be testing in a few hours today. Today is your day, Rose. You made it. You're not supposed to be here studying. I hope you're just here for the fun of it. All right. You can do it. You can do it. Shantia says, I study quick facts from the front and the back. I know it like the back of my hand. Yes, front to back. I love that. You got to know this book. All right. Okay. Which age group normally gets von Gierke's disease? I like the generalization. Rose, people are congratulating you already. A lot of people want to be in your position. You're testing in a few hours. Man, that's an awesome place to be. All right. Here we go. Next question. Oh, okay. This is question 69. Why must TPN be gradually decreased? You guys are experts on this. If you attended ReMar Nurse University this year, there's nothing I can't ask you. Okay. Rose says you can't miss your sessions. Love that, Rose. No, we talked about this. We definitely talked about TPN almost ad nauseum. We really went over it. So we want to avoid, some people are saying hypoglycemia. Some people are saying hyperglycemia. Which one is it? Which one is it? All right. Is it hypo or is it hyper? I see two different answers. You got to get that cleared up before this day is over. All right, I'm moving on. Oh, I like this one. This is a very fundamental, basic question. Can skin be sterilized? Yes. Can skin be sterilized? This is a good question. This is a great question here. Can skin be sterilized? We're getting these answers from the Quick Facts book. We're not making them up. They're very specific. We're studying our tool. We're studying our resource tool, which is the Quick Facts book. And sometimes when you're studying for your NCLEX exam, you don't have to spend hours and hours and hours reading lengthy paragraphs of things. You know, I love med-surg books, but they are not appropriate to use when studying for NCLEX because the information is bulky. It's not according to the test plan. All right. So we're talking about skin being sterilized. Some people are saying no. Some people are saying yes. We'll find out. We will find out in a few. All right. Angie, we're studying the back of Quick Facts. We're studying the 5-star version. Okay. So this is the latest version. It has 5 stars across it. We're studying pages 60 through 80 in the back of this book. Okay. Yes. Quick Facts is straight to the point. All right. Here we go. 71. Oh, sickle cell anemia causes the sickled cell blood to do what? All right. Nursing students, my students who are in nursing school, this is perfect. This is information that you need to leave with. You should not graduate nursing school without knowing these basics. Okay. And let me tell you, a lot of nurses working don't know the information in Quick Facts. That's just what it is. That's just the truth. So I always expect ReMar nurses to step it up a notch when they get hired anywhere, because you guys come in with a vast amount of knowledge. Okay. All right. Sickle cell anemia causes the sickle blood to do what? Right. I think you guys got this one. Okay, this question, this comes directly from the virtual trainer because I know too that we go over infection control in the virtual trainer. So this question is, a negative pressure room should have how many fresh air exchanges per hour? This also comes from Quick Facts, of course, but I know I lecture on this. A negative pressure room should have how many fresh air exchanges per hour? Okay. And I'm looking at the answer right here in the Quick Facts book. It's literally right here. And it's under tuberculosis if you need to find it. Okay. A negative pressure room should have how many fresh air exchanges per hour? Because remember, you guys should be thinking, okay, which ones am I getting right and which ones am I getting wrong? So that when this is all over and said and done, you know what you need to go back and study from the book. Okay. Or, you need to get the book if you don't have it. All right. Also, okay, here we go. Moving on. Question number 73 also comes from a very important topic. When taking tuberculosis antibiotics, what vitamin will be depleted? Yes. When taking tuberculosis antibiotics, what vitamin will be depleted? Oh, this is so good for risk reduction in your patient. You have to know things like this. Risk reduction. If you can proactively anticipate your client's needs, you can avoid them from having many complications. All right. I love it. You guys got out your quick facts book. You are studying with me. All right. Here we go. Question number 74. What are the isolation precautions for herpes zoster? Okay. Oh, you can get the quick facts book at remarnurse.com. Okay. You can get the quick facts book at remarnurse.com. And so we're talking about right here, what are the isolation precautions for herpes zoster? We only have a couple more questions left. Guys, there was no workbook for today. There is no worksheet for today. We're literally just studying questions from this book. Okay. So you are not missing anything unless you don't have this book and you don't know the answers to these questions. All right. So what are the isolation precautions for herpes zoster? And I see you guys putting two answers here. Okay. I see you guys putting two answers here. All right. Okay. So we're gonna talk about the two answers and which one is better. And I'm literally just pulling questions out of the book. These are questions that come from my mind, questions that come from the book, but they're based on the quick facts. All right. What are the indications for a tracheostomy? What are the indications for a tracheostomy? Meaning, why would a patient need a tracheostomy? Leticia, yes, if you have the book, you can just get the virtual trainer. All right. Sonia says, I'm at work. I don't have my book. I am using my brain only. That's right. That's how you do it. I mean, what better way? What better way? Okay. What are the indications for a tracheostomy? What are the indications for a tracheostomy? Oh, yes. People are saying, oh, okay. I see the answers on the screen. I'm not going to say them out loud. Everybody, just feel free to contribute. Some of them you may know, some of them you may not know. But this is a huge study group right now. We have about 700 nurses studying right now the Quick Facts book. So congratulations, you made it to the live. All right, here we go. Question number 76. Okay. Which vitamin is important in clotting blood? Which vitamin is important in clotting blood? Okay. Here we go. Straight out of Quick Facts. We're studying for the NCLEX. Gazelle says, I passed NCLEX thanks to ReMar, but I still love to come in and visit the lives whenever I have time. And we love to see you here as well. Absolutely love to see you here. Also, what did I want to say? Oh man, that just totally blessed me. I lost my train of thought. All right. It is what it is. We're talking about which vitamin is important in clotting blood. All right. And you know what? This feels so good. Usually we do 5 questions and then I'm out. We do our Monday motivation, then I'm out. But I like this. This might be the thing here. Going over the information in a different way. I like new things. All right. So here we go. Next question. We're really getting down to it right here. 77. There's 3 more questions left. What class of medication can you give to decrease tardive dyskinesia? Yes. What class of medication can you give to decrease tardive dyskinesia? Right? All right. I like it. I like it. I'm asking for the class of medication, but somebody is giving me exact medications. I'm okay with that. We'll just see. We'll reconcile it. We'll reconcile it. Okay. And remember, the back of Quick Facts is all medication. So I didn't want to do a pharmacology because we just came off of pharmacology. So we'll take a break from it for a while. All right. Here we go. I'm moving on. Question 78. How will the liver appear with von Gierke's disease? Okay. Sheila, I got to read this. Passed my exam through ReMar last year. Missed these live videos with you, Regina. Love seeing more nurses here. Good luck, everyone. Claim your license. God bless. Thank you so much, Nurse Sheila. Thank you so much for coming back and saying that. That encourages me to keep going. All right. All right, here we go. How will the liver appear with von Gierke's disease? All right, we almost got 500 on Facebook. Come on, share this video. And then, yes, Quick Facts is shipped to Canada. Yes, we love our Canadian nurses. All right, here we go. Question number 79. I'm going to show it, and then we're going to roll into the answers. How long do red blood cells live in clients with sickle cell anemia? How long do red blood cells live in clients with sickle cell anemia? Oh, this is a good one. Okay. This is a good one. What do you guys think? What's the time frame on that? What is the time frame? I'm seeing all kind of numbers. Okay. So people are saying 30 days, 20 days, 10 to 20 days. Okay. 120 days. All right. I'm glad you guys are participating. That's all that matters. But think about sickle cells. What makes them so unique? What causes so many complications for our patients? All right. Here we go. Question number 80. This is our last question, guys, and then we're going to go over the answer. Okay. How about that? Question number 80. What should the nurse always do before suctioning a client with a tracheostomy? That's it. What is it? What is the one thing? And I'm talking about the registered nurse here. Okay. What's the one thing that the registered nurse must do? Okay. Before suctioning a client with a tracheostomy. Oh, yeah. You guys got to make sure you're answering the right questions, because some of the answers to the questions you're giving me are not the question. It's not the question that I'm asking. All right. And that's how you can mess up and fool around and fail NCLEX. All right. By just providing the wrong information, especially math, especially those fill in the blanks. All right. So we have people are like, oops. Okay, let me read it again. All right, so let's go over the answers, shall we, ladies and gentlemen? Yes, we made it to over 500 on Facebook. All right, okay. Pages 61 to 80. Here are the answers. So if you're just joining us, we went over all of these questions. We gave it our best. Here are the answers. Again, we're studying the 5-star quick facts. So some of you are saying, I don't have these questions. I don't have these topics. We upgraded the 5-star quick facts. So the original one is missing some of these things. All right. So here we go. Question number 1, herpes zoster is caused by what virus? A lot of people got this one right. Varicella. Okay. Did you guys get that one? You have to know, you got to know varicella. You got to know the isolation precautions for this particular condition. All right. Who normally gets it? Remember, we see We see shingles in the adult population. We have to have a previous exposure to varicella to have shingles. So if a person has never had varicella before, we would not expect them to have shingles. We would not expect them to have shingles. Is there anybody in here who has never had chickenpox? Is there anybody in here who has never had varicella exposure? Anybody? One? Is it one? Am I the only one? I'm the only one who's never had chickenpox before. Maybe. I don't know. But I am thankful for that. Here we go. 62. Tardive dyskinesia is a side effect of what medication? And that medication is the antipsychotics, all right? The antipsychotics. So we're talking about, I don't want to get into too deep right now, but you guys know that there's typical and atypical. All right. So typical and atypical. All right. All right. Here we go. Oh, Kanisha says I never had it either. Oh, a lot of you have never had chickenpox before. Oh my goodness. So I'm not alone in this world. All right. So check out the difference between typical versus atypical antipsychotics. 63. What organism is the cause of TB? You have Mycobacterium, tuberculosis. Yes. All right. Yes, this is our free review. We do this every Monday. There's no surprise here. We love showing up and making sure that last minute stuff just gets done, just gets reviewed. Okay. So here we go. Let's move on. This one was about total parenteral nutrition. Remember, you have to change that TPN bag every 24 hours. And why do we do this? Because of what? All right. Why do we do this? Because we have to do this because the TPN, the TPN is mostly made of what? What substance cannot sit out for a long period of time? All right. It is going to be dextrose, right? And so the TPN is mostly made of dextrose that when it's out in room temperature, it's easy for bacteria to ferment. Yeah. All right, Ruby, it's your birthday. It's your birthday. We're so happy that you're here celebrating with us, studying for your NCLEX exam. All right. Shout out to Ruby. So happy birthday, Ruby. She said, it's my birthday. I'm here doing the right thing. All right. So we congratulate you. Okay. All right. 65, vitamin C. Vitamin C is it's the vitamin that helps with iron absorption. Okay. It helps with iron absorption. So yes. And so I see the comment where somebody's saying, I have the quick facts book, but I don't have the answers for the quick facts book. Actually, the answers are in the book. So if you look at the question on one side of the page, the answer to that question is right on the other side of the page. Okay, it's right there. So it's not a book that you need to go searching around for. Also, shout out to the study calendar. All right, the study calendar in the front of the quick facts book is useful to help you get through this material, We lost it. Help you get through this material in 3 weeks. All right. And I definitely want you to have this material mastered in 3 weeks. Okay. So we're talking about the 5-star quick facts. All right. Not the original version here today. Okay. Next question was the cause of ulcerative colitis. It was a trick question. All right. It was a trick question. The cause is unknown. Yes, the cause is unknown. Okay. Wilson's disease was a new topic that I had created, and I didn't create Wilson's disease. I didn't discover it, but I did add it to the 5-star quick facts. And so yes, the liver and the bees. So definitely review that particular topic. All right. Somebody put up what's Wilson's disease, because a lot of people are probably like, I never heard of it before. But yes, this is a subject that you want to know about. Absolutely. We're studying pages 61 to 80 in the quick facts book. Okay. All right. International nurses. I'm an international nurse. I love it. The most simplest book. All right. Also, hey, von Gerk's disease was also a new topic that I added to the 5-star. So what age group normally gets it? That would be children. Okay. It's a pediatric disease. It's a pediatric disease. Hey, did you guys know that there is a free version of this book? You know, I love free things. I created a free version of the Quick Facts book for pediatrics. So it's all pediatrics. It's in your virtual trainer under the file vault. So if you have the VT, go to your file vault, download and print Quick Facts for pediatrics. It's there for you. Okay. All right. Question number 69. This was a controversial question. We talked about TPN being gradually decreased. Was it to prevent hyperglycemia or hypoglycemia? It was absolutely hypoglycemia. All right. And so we have to be very careful that we don't get those two confused, because if you are decreasing the TPN, the blood sugar will drop. Okay, the blood sugar will drop. All right. So, okay. So we saw some people that say, hey, I didn't know that the pediatric Quick Facts was in there. It's there for you in the virtual trainer. Okay. 70, can skin be sterilized? No, skin can only be clean. It can never be sterilized. All right. And just think about it. Because skin is constantly on the outside being exposed to environments, dust particles, all kinds of things, you can't sterilize the skin. You can sterilize internal organs, so you can sterilize the bowels, right? Because they're inside. You give a patient neomycin, it will destroy all the bacteria in the bowels. The cavities of the organs should be sterile. That means there's no bacteria. So inside of your heart is sterile, right? Inside of your bladder should be sterile. There should be no bacteria. When we take a urine sample, everybody's urine should be bacteria free because it's coming from a sterile place. So we know that if I get a urine sample from you and there's bacteria in it, you have a bladder infection of some sort, right? You have bacteria where it's not supposed to be. So that's what I want to say about that. The skin, not sterile. It's on the outside. The inside of your body cavities should all be sterile, except for your, of course, except for your intestines, and your mouth as well. All right. So there is bacteria that live in your mouth. You know that. You're not sterilizing that. All right. Here we go. 71. Sickle cell anemia causes the sickle cell blood to do what? And almost everybody got that. Okay. Everybody got that. It is clotting. It is clotting. Yes, I can explain how to use the study calendar. I'll answer questions at the end of this. We're almost finished. So keep your questions for me. All right. Going into my last year of the BSN program. Okay. I love these live videos. Thank you. Awesome. All right. Awesome, Sydney. You're almost there. Okay. 72. We are talking about respiratory isolation here. Negative pressure rooms are required. How many fresh air exchanges per hour do we need? Okay, we need 6. 6 is the minimum. Okay, 6 is the minimum. And with the whole coronavirus, there's probably more. However, this is the number that we're going to study for. Okay, this is the number that we're going to study for NCLEX. All right. And these are just, we're just picking random pages from 61 to 80. We're actually reviewing. So if you guys are just joining us, you got to go back. You got to go back. All right. Question 73. We had asked, when taking tuberculosis antibiotics, what vitamin will be depleted? That is going to be vitamin B6. Vitamin B6. All right. All right. Here we go. And question 74. Isolation precautions for herpes zoster. We want to use respiratory. And I saw a lot of people putting contact down or putting contact and respiratory, which is technically, it's not incorrect. All right. If you go to the Center for Disease Control and you are looking for the isolation precautions for herpes zoster, you very well will see contact and respiratory. However, for our board exams, when you're not given the option to pick two, you have to pick one. You need to go with the highest level of protection. So you would pick respiratory. Okay. You would always pick respiratory. And it's the same for pneumonia. You'll see CDC will say use universal, use contact, use droplet, right? But for the state board exams for nursing, you choose droplet. Okay. Okay. Here we go. Question number 75. What are the indications for the tracheostomy? All right. What are the indications for the tracheostomy? And that is any upper airway obstructions. And some of you guys have put, being failure to wean from a ventilator. Okay. Airway obstruction. So yes, the tracheostomy is for that upper airway obstructions. Increased mucus is an example of that. All right. Here we go. We have question number 76. We are rounding up for the finish. Which vitamin is most important in clotting blood? That is going to be vitamin K. Easy. All right. And this is especially important when you have a client on warfarin or Coumadin. Also in our neonates, our newborns, before a baby boy is circumcised, typically in the hospital, what do we give him? We give him a vitamin K injection. All right. A vitamin K injection so that during that surgical procedure, his blood doesn't bleed out. Right. Does anybody know normally babies are not born with vitamin K adequacy, right? So does anybody know how long it takes for your body to synthesize its own vitamin K after birth? Because when you're born, you don't have this vitamin K that you need. That's what we have to give it in the hospital. Does anybody know? 24 hours, a bit longer than that. But it's a very brilliant question, and it's very important to know. All right. So the answer is it's about a week, right? It's about a week that the vitamin K actually is synthesized in the body. So if a mother or a father refuses the vitamin K injection for their infant, should the infant be circumcised? Should the infant get any kind of surgical procedure? No. All right. So very important teaching point for the registered nurses. Okay. 77. All right. What class of medication can you give to decrease tardive dyskinesia? All right. And that is anti-Parkinson's medication. If you think about the signs of tardive dyskinesia and you think about Parkinson's disease, then you will kind of have an indication of why you can give one for the other. Okay, why you can give one for the others. Hold your questions to the end. All right, and then I will go over them. I promise I will. All right. Here we go. Question number 78. How will the liver appear with von Gierke's disease? You know von Gierke's disease? It is preeminent to know. Okay. Natalie, I'm so glad that you made it to this live. I'm so glad that you're here for this live study session. They are powerful. They're short, but they're powerful. The liver's going to appear fatty. Yes. And there is a reason why. Why is the liver appearing fatty with von Gierke's disease? What's happening to it? All right. Love this one. A ton of controversy, a ton of mixed answers. How long do red blood cells live in clients with sickle cell anemia? Okay. That is going to be 6 to 20 days on average. All right. A lot of people have picked that 120 days, which is what you would expect the normal RBCs to live. And so literally it was just a matter of just misreading the question. And we have to be so careful that we don't do that when we're taking our NCLEX exam, because we're ready to give everything that we know. Okay. We're ready to give everything that we know. So somebody says this happens every Monday. Yes, this happens every Monday. We're doing something a little different by studying a specific product, but usually on Mondays, we just study NCLEX questions here. This is what we do. This is ReMar review. All right. And our final question, hey, what should the nurse always do before suctioning a client with tracheostomy? And that was hyperoxygenate the patient with 100% oxygen, okay? That is what the nurse should do. Did you guys get that one? That's very important as a skills checklist. That's very important as a drag and drop. Okay. All right. So I don't have anything like really formally prepared, but I just want to spend some time answering some questions that you guys may have. I also have my typical Monday motivation, which is just this thought. And it helped me get through this weekend, which was kind of tough for me. You must expect great things of yourself before you can do them. That's my Monday motivation. You must expect great things of yourself before you can do them. And that's what Michael Jordan, that's like one of his sayings. And so you think about, athletes and people who do their job extremely well. Well, you don't just get up and do it. Like, you have to have the mentality, number one, that I am capable of achieving this feat. And so, that is something that I wanted to just leave you guys with for this week, is the positive thinking about all that you have already done. You've already done, when it comes to NCLEX, you've already done greater things than NCLEX. Some of you guys just getting through high school, getting through into nursing school was a great achievement. A lot of people who have not gotten to that level of education. So NCLEX is no different. It's just a challenge in a different suit. It's the same thing. It's just another challenge in a different costume. You know how you wear Halloween costumes every year, but it's the same person underneath. That's what life is. Like, you have these challenges. They're just dressed up in different forms. And so NCLEX is just like that. All right. So that's my motivation for you guys. Again, you must expect great things of yourself before you can do them. And then also, as way of announcements, the ReMar Virtual Trainer Question Bank is going to launch next Monday. I'm super excited about it. We are finishing up the final touches. Oh my goodness. remarnurse.com is where you'll be able to get it. You'll be able to access it. You guys know I wanted to have it. I wanted to have it ready for you guys this Monday. The developer was just like, that's not happening. Mark and I were up to like 4 a.m. Yesterday. And so we're going to get it ready for you. It's pretty much almost there, but I don't want to rush and put something out that you guys won't be happy with. So I'm launching it next Monday. Okay. remarnurse.com for that. And then this whole production was brought to you by the 5-Star Quick Facts. It is on sale, Black Friday price this Monday. All right. You can get it remarnurse.com. Also, the bundle is available. Is that right, Mark? Okay. So the bundle is available that has the question bank book as well. So if you want questions in the book form while you're waiting for the online, you can do that as well. But the question bank is coming. Okay. All right. So here we go. My first question that I'll be answering is question and answer time. The first question is how to use the Quick Facts calendar. So the 5-Star Quick Facts does have the weekly calendar in it. And essentially, I have here 1, 2, 3, 4, 5. I have you studying 5 days a week. So every box represents however many, whichever day you want to study. So if you want to study Monday through Friday, every box you'll do for just one day. All right. So, and you shouldn't be studying more than like an hour, 2 hours with this book. Okay. So the first box says quick facts, QF pages 1 through 10. So you're going to go to quick facts pages 1 through 10 and just study it, read over it, highlight things you don't know, skip over things you do know. All right. And then in the back of the book where it says QF pharmacology, that means go to the pharmacology section in the back of the book. Okay, because you have to, I have you studying pharmacology every day because that's just how you have to study pharmacology. Okay, go to the pharmacology section and then do your studying for that day. Okay, do your studying for that day. And so you will study the front of this book and the back of this book at every study session 5 days a week. And that's how you can finish this book in 3 weeks. Okay, that's how you can finish this book in 3 weeks. All right. So that's that. Does that answer your question about how to use the calendar? All right. Next question was, what is the deadline for the NCLEX exam again? September what? So right now it's September the 30th for the modified exam. I'm assuming that's what you mean. So if you take the exam before September 30th, you will get the modified exam. Hi, Regina. I purchased the VT and quick facts. Your voice was in my head when I took the NCLEX Monday. I passed in 60 questions. Thank you so much, Regina. I'm a ReMar nurse. That's what we want. That's what we want. 60 questions. Congratulations. All right. The question bank book is back in stock. It is back in stock as the bundle, or can they buy that individually? You can buy the question bank book individually now. It's back in stock. All right. $15. We're doing Black Friday prices. All right. So yes. You guys know we had literally over 400 nurses. When we do sales on things, our stuff sells out. We had 1,000 nurses sign up in the virtual trainer. But there's only 200 of the question bank books. So for the RN, and 150 for the PN. Okay. So if you want to get it now. All right. Oh, and it's about to rain here. So before my internet cut out on me in Ohio, let's see. Dina says, I just ordered the bundle. All right. Yes, question bank book is in stock. Okay. So if they don't have, okay. So I see what you're saying. Student says they don't have any test dates available in September. Should you try October? Yeah. Also check different states. You guys know if you're taking NCLEX and they don't have anything local, you might have to drive. If you can drive to another state, you may get a sooner test date in a different location. We have had nurses having to do that, going to different states, driving several hours. So, however you want to do it. And if you're set on taking that modified exam, you may have to go to a different place. Also, I want to say too, is that, with things being the way they are, I don't think that September 30th is a hard cutoff for the modified exam. I do anticipate them extending the modification throughout the rest of the year. That's all I'm saying. Okay. All right. My virtual trainer doesn't have the quick facts questions 60 through 80. It stops at questions 40 through 66. Okay. Send me an email, Faith, because I'm not sure. All right. They do have dates available. How many questions will be in the question bank? The RN has 1,200 and the PN has 1,100 right now. Is the NCLEX Ready question book same as the question bank? No. So the question book is actually a book. There's only 400 questions in the question bank book. All right. In the online question bank, there will be 1,200. Okay. All right. Jacqueline says, out of school for 6 years, failed 3 times and just turned 50. Watch that. There's actually a tornado warning right now in my area in Ohio. In Ohio, we don't have hurricanes or anything like that, but we do have tornadoes. Has anyone passed after so long out of school? Oh yeah, 6 years. 6 years is not a long time around these parts. So if you're new to the ReMar community, we actually really have had students who have been out of school 20 years, 30 years, 40 years. All right. So don't feel dismayed or like you cannot do it. All right. Age, school length, these things are not barriers to you passing. All right. Okay, so I have to get out of here before I end up in the land of Oz. All right. So the questions that you saw earlier, they come from this book. All right. So we were just doing random questions from this book. Okay. Is the VT still on sale? So the VT is still on sale. It's just not the sale that we did for ReMar Nurse University. So the VT is $189. All right. So which is not bad. It's $15 a week, basically, for 3 months access to the virtual trainer. So it's still a great price. I honestly would still take advantage of it. All right. Okay, guys. So again, yes. How do I get, okay. So the question bank book, or if you want quick facts or the bundle, you guys know you can get that at remarnurse.com. Amazon does not have the question bank book. No, it doesn't. All right. What is the price of the online question bank? Great question. Okay. The price of the online question bank will be $29 for 30 days. Okay. So an amazing price. 1,200 questions. You can pick and choose what questions that you want to purchase, which questions that you want to practice on, and the price is amazing. So we are going to open it up to people who have the virtual trainer next week, and we'll see how that goes. I don't want to put too many people in there because, we want to be able to service everybody. So we'll be doing that sale. All right. Yes. Hyperoxygenate, preoxygenate, same thing. If you order the quick facts now, it should be there in about 3 days. Okay. Okay, guys. So listen to me. If you guys have any other questions about customer service or anything else like that, I want you to email support@remarreview. Please, that is our official email address. That's our official email address. So please make sure that you are emailing that location. No other emails, because a lot of people will say, well, I emailed you guys, I never got an answer back. Make sure that you're emailing the correct one. Okay. All right. So thank you guys so much. Thank you guys so much for supporting ReMar. Send a shout out to Team ReMar for helping during this time. Have faith. Remember, we always say this, here, remarreview, this is our motto. It is, I can, I will, and I must pass NCLEX. All right, take care. Love you guys.